Why scientists hope to inject some people with the Zika virus. What is the Zika virus? Zika virus disease is caused by a virus transmitted by the Aedes mosquitoes. There are no specific treatments or vaccines currently available for the Zika virus. The best form of prevention is protection against mosquito bites. The virus is known to circulate in the Americas, Asia, Africa, and the Pacific. Zika virus is an emerging mosquito-borne virus that was first identified in Uganda in 1947 in rhesus monkeys through the monitoring system of sylvatic yellow fever. It was subsequently identified in humans in 1952 in Uganda and the United Republic of Tanzania. Outbreaks of Zika virus disease have been recorded in Africa, the Americas, Asia, and the Pacific. The incubation period, or the time from which the exposure to the symptoms occur, of Zika virus disease is not clear, but it is likely to be a few days. The symptoms are similar to other arbovirus infections such as dengue and include fever, skin rashes, conjunctivitis, muscle and joint pain, malaise, and headache. These symptoms usually are mild and last for 2 to 7 days. Why scientists hope to inject volunteers with the Zika virus. This is an article that was posted on NPR, and in the article it talks about how they feel as if one of the best ways to understand the Zika virus might be to deliberately inject it into volunteers. The idea, yes, it might sound a little crazy, but it's not unprecedented. And some of the researchers are hoping that the approach could help speed up the search for an effective Zika virus. Right now, there are a bunch of labs that are pursuing different ways of making a vaccine against Zika, mostly because of the concern that the virus might be linked to the birth defect microcephaly. At the Vaccine Research Center at the National Institute of Allergy and Infectious Disease in Maryland, scientists are creating different versions of DNA-based vaccine. Which one is the best? They are testing it in animals and using it to select their top candidate, says one of the virologists at the center. If any vaccine candidate looks good in animal tests, it could then go for initial safety testing in people. After that, scientists somehow will have to show that the immune response elicited by the vaccine will actually protect people from getting the infected disease of Zika virus. If any vaccine candidate looks good in animal tests, it could then go for initial safety testing in people. After that, scientists somehow have to show that the immune response elicited by the vaccine will actually protect people from getting infected with Zika. There's no easy task, and no one can say for sure how long it will take. Most vaccine development efforts are measured in decades, says Dr. Barney Graham of the NID Vaccine Research Center. Almost every vaccine we have for a viral disease has come several decades after the discovery of the virus. New technology does make it easier to quickly develop a vaccine concept and test it in animals. However, he notes that you can't really have it for public use and distribution until you're able to prove the efficacy. Proving that a vaccine works often takes very large organized field trials. Those kinds of field trials are difficult, time-consuming, and sometimes just impossible. For example, by the time the Ebola vaccine was ready to go into a large study, for example, the outbreak in West Africa was winding down. Not enough people were being exposed to Ebola to prove that the vaccine would protect them. There has already been a kind of study like this done to evaluate a potential vaccine for dengue, which is a closely related virus. Dengue can cause serious illness, but one particular dengue virus just causes a rash, and people did agree to be injected with that type of virus. That then let Durbin and her colleagues show that the dengue vaccine really seemed to protect people from infection, making them feel more confident about moving forward with larger trials. They would like to take a similar model and apply it to the Zika virus. But the situation with the Zika virus is a little more complicated. That is because, in addition to the possible connection with microcephaly in fetuses, Zika infection in adults may be linked to Guillain-Barré syndrome, which is a disorder in which the immune system attacks the nervous system. They do not want to put healthy people at risk for that because they are normal, healthy people. Still, people already feel a small risk of getting Guillain-Barré from a more mundane infections like diarrheal diseases or the flu, and it is unclear how often this actually happens with Zika virus. That is something that the scientists are trying to now understand, and they are trying to figure out whether it would be ethical to ask people to take a shot of the Zika virus to help the search for a vaccine. So, who are the major stakeholders or players with this article and the Zika virus that is now being transmitted? I would say that the travelers are definitely some of the people who are the major stakeholders in this because they're the ones who are really exposed to the vaccine when they travel to different areas around the country where the Zika virus may be present, and then there's more of a risk for them to attain the Zika virus themselves. I would also say that doctors are a major stakeholder or player within this because they're the ones who will be working with the researchers to develop the vaccine and find the one that is correct for everyone to get so that the prevention of the spread of the Zika virus can be furthered. I also feel that the scientists and researchers are also major stakeholders or players within this because they're the ones who work with the doctors and other medical professionals to come up with the best vaccine that they feel would treat the Zika virus or help those from getting the Zika virus. I also feel like those volunteers who would volunteer to be testing would be major stakeholders because if they don't have volunteers who are healthy to test the virus on, they won't be able to test their own way of trying to prevent the spread of the Zika virus through this vaccine. The people who are getting the vaccine and the Zika virus tested on them are really at the key core elements of what this article is talking about. And lastly, I feel like children are major stakeholders and players within this because they're the ones who seem to get affected from the disease more often than grown adult individuals. Who is affected by this? Children, travelers, volunteers, individuals throughout the world, and those who live in the countries with the reported cases are the ones who are affected by this. Children are affected by this because their immune systems are low and they have a higher risk of attaining the Zika virus. Travelers are also at a high risk for this and are affected by this because when they travel to different parts of the country, especially those places where the Zika virus has already been reported, there is a higher risk for them to be exposed to the Zika virus and they can then get the Zika virus themselves. Those volunteers who would go and be the ones to get the Zika virus put in them would be affected because they're injecting a live virus into their body. It might be weakened, but it's still a live virus and it can make them sick. Also, individuals throughout the world are affected by this because it has been spread throughout different parts of the country and you never know when you might be exposed to the Zika virus. And lastly, those who live in the countries with reported cases are at a higher risk of attaining the Zika virus than some of those who do not live in the country where the Zika virus has been reported. My opinion is that I think this is a very controversial subject to talk about and make an article about. I agree that I find that it would be very beneficial to go and find the vaccine and then inject an individual with the virus, but I also feel like that's taking a big risk in doing that because there's nothing necessarily saying that the vaccine will actually work and the individual might get really sick because the Zika virus was injected into them directly. I think though that this is a great way to continue to try and come up with a vaccine for those diseases that are not as severe, such as dengue fever, and they used the type that had the rash with it associated with it. Lastly, my hopes and concerns for this are that I'm very hopeful that they will be able to go and find a vaccine that then can be spread throughout the world to prevent the acquisition of the Zika virus by most individuals. I really hope that they don't have to go and use volunteers and inject the vaccine directly into them, because I think that there are a lot of concerns in doing that, especially the fact that the individual might become sick and the vaccine might not work. And this could lead to further health complications and possibly even death if it gets to that severity. But I am very hopeful that they can find a vaccine that can help most people so that the prevention of the Zika virus can be attained, and that we won't have to worry about the Zika virus throughout the world, hopefully soon again.